So today we're going to be talking about conducting a community assessment during the COVID-19 pandemic. We know that agency processes go on even during times of crisis, but modifications must be made in order to carry out these processes effectively during different times. So we're going to be talking about a few different things today. We have a guest presenter with us as well from the University of Missouri Extension. And so we're going to be, first of all, talking about the value of still doing this assessment process during a crisis time. Also going to talk about some different tools that we have at the Community Action Partnership that may be able to assist you. Then we're going to have Jamie Kleinsorge from CARES at the University of Missouri Extension talk more about data collection, analysis, and prioritization, including some of their COVID-19 data tools that can be used, whether you're looking at simply assessing your local community in how you're going to respond to the COVID-19 pandemic, or if you're doing a more comprehensive assessment during this time as a part of your regular community needs assessment timeline. Then we're going to wrap up today talking about some different modifications you can consider, such as gathering different type of qualitative data whenever you're considering, social distancing measures and people working remotely, so that you can still carry through and get good data collection and still get a comprehensive needs assessment during this time. So just want to talk a little bit about the value of still doing assessment during COVID-19. Some of you may be adjusting your timelines if you're in the process of starting your assessment, or maybe you were mid-community needs assessment process during the time when all of this kind of began. Or maybe you're looking towards starting later this summer, or maybe even just simply updating your full community needs assessment in response to COVID-19 and utilizing the supplemental funding. But there's a few different values to doing this. It might seem overwhelming. I know that everyone is very, very busy during this time, and that this response requires flexibility. It requires new roles and new things to do as well, on top of other things that have to be done too. So, but just want to kind of consider, that there is still this important value in doing this during this time. First of all, it documents history. And so you're able to kind of keep record of what had happened during this time to be able to look back on that. Also determining the baseline and the needs that are present created by COVID-19. And then therefore you can kind of demonstrate what the role of community action is in response, and how community action is so important in times of crisis like this. And then also just thinking about how we identify conditions that then contribute to the community's ability to respond to crisis. So thinking about how prepared was your local area or your local community, even your own agency, to be able to respond during this time. And so that's something else that you might be able to look towards future improvement in being able to be have the capacity, whether it be the whole local community or your local agency, and thinking about how do we make sure in the future that maybe we're more prepared to be able to respond more effectively, or also realizing what assets you had in responding very well in areas that you were able to jump right in and start assisting the community as you needed to. So with that, I want to turn it over to Aaron Wicks for a moment. He's our Vice President of Organizational Capacity Building. And so he's going to talk a little bit about some of our tools and the purpose behind those tools.
All right. Thank you, Courtney. And good afternoon or morning, everyone, depending on where you are. I just want to emphasize what Courtney said about the different places that we're all in terms of our capacity right now to even think about a community assessment. And I want to make it clear that we at the partnership are doing our best to meet the needs of the network at this time. And so one of the things that we've done is provided a sort of an update template and list of data resources that we produced about a month ago in April. Our intention there was to provide the network with a document that hopefully could be fairly easily completed. And what we sort of recommend in terms of how you think about a template like this, particularly at a time when there's very limited capacity to do data collection. You know, I don't need to collect data. I know what's going on, and I think just about every community is in a situation like that. The idea of the template was to sort of just lay down a marker and say, at this point in time, here's a very quick snapshot of some of what's going on. And what we've come to understand is that for some agencies, doing a community assessment is a very thorough process, and the idea of doing a quick assessment is not something that that many of us have done, because when we do it right. So we are in the process of producing a sort of easy version. I think of it like this is a horrible analogy actually now that I think about it, but if you think about a 1040 tax form and how tedious and complicated that is, there's the easy form if your finances are pretty simple and you can just kind of fill out a few lines and you're done. What we're going to be coming out with later this week, we should have it up on the website on Friday, is a very simple community assessment template that you can literally just go through, and step by step we'll take you to the website that you can go to get the data, plop the data in, plop the map in, whatever. And then you can sort of close the book on that and say, this is the best that we can do now, and we'll do a more thorough update when conditions allow for something like that to be done. So we've responded to some feedback that we've gotten, and I just want to let the network know that we welcome that. And so anytime we come out with a tool, if you've got some feedback for us, let us know how it works, what doesn't work, and we'll try to get you an even better tool next time around. So look for an even shortened community assessment update template coming out on Friday.
All right, thanks, Aaron. Also, just want to note that for people who are in their full community needs assessment process, we do have this. It's a workshop facilitation guide, but it's also basically just a guide that helps you work through conducting your community needs assessment. So that's the one on the left-hand side of your screen, conducting, sharing, utilizing a community needs assessment. That was done as part of our Roma Beyond the Basics training series. So basically it takes a very deep dive into the assessment process and how that then connects into planning. So this kind of takes you through that full needs assessment cycle. And then of course, the one that Aaron was talking more about with the update template looks more at how do you update your needs assessment in response to COVID-19. So with that, we want to go ahead and jump into some more of our content for today and get to our presenter. We have Jamie Kleinsorge from the University of Missouri Extension, and she works with CARES, which is the Center for Applied Research and Engagement Systems. She's a senior project coordinator there, and we've worked with her for many years as we work together on the CAP Engagement Network. So CARES is actually the organization that hosts the CAP Engagement Network, which some of you know formerly as Community Commons, our CNA online data tool. And so she's going to be, she's done training for our network before, but she's going to be talking with us today about conducting a community assessment during this time, talking more about data collection, analysis, and prioritization, as well as some of their additional data tools that they have available. So Jamie, I'm going to take it away and I'll advance your slides for you.
Great, thank you. Can you hear me?
Yes.
Great. Good. All right. Yeah, I had a little trouble getting on today, so I appreciate the few extra minutes there at the beginning. So as Courtney said, my name is Jamie Kleinsorge, and I'm happy today to talk a little bit about how we think about selection during and analysis during a crisis like this. We've come up with some recommendations, and by no means do you need to take all of these into account as you're doing your community needs assessment, recognizing that they're all sort of unique to your community and your community conditions. But just recognizing that there are some steps and precautions that we should take as we are doing data collection and analysis a little bit differently because of the COVID-19 pandemic. So just a little overview of what we're going to go over today. First, as you see here, we're going to talk a little bit about the effects on data collection methods, so those actual instruments that we use like surveys and focus groups. How should we think about changing those or adapting those to meet the current restrictions or restrictive environments that we're living in? Effects on responses and response rates. We've seen sort of both ends of the spectrum on this, and so we'll talk a little bit about ways that you guys can talk about your response rates or potentially increase those as well. Effects on data analysis. So how do we look at pre, during, and post-pandemic, and why is that important? And then finally, effects on prioritization. So old issues versus sort of new issues, funding considerations, those types of things. So as I was putting this presentation together for another community action association, I found this quote that you see here on the right where it says, crises are by definition unexpected. Definitely this was unexpected. Non-routine, and it creates conditions with the potential to render what we would consider traditional research difficult. And so just want to recognize that we know that this has created a little bit more difficulty, right, in doing our job and doing community needs assessment, even for those of us who are seasoned at doing CNAs or have done something similar in the past. And so while I know it's not always comforting to know that people are dealing with the same issues, I think it's important to note that because we have an opportunity to hear from all of you what you're doing to sort of overcome some of these potential barriers, or to, have successes even in this kind of strange time that we're living in. So we'll have some opportunities towards the end to potentially share some of those stories. So moving on to the next slide, we'll jump right in talking about the effects on data collection methods and responses here. So as we mostly know, data collection has been being done remotely, and I imagine that we'll continue to do quite a bit of our data collection remotely, even though states are starting to reopen and we're starting to see some more, interaction between folks on a regular basis. Just keeping in mind those safety concerns, we know that, data collection can be done remotely, and there are many mechanisms which we can use to be able to continue to do that safely. And a lot of those are online, right? So we think about different types of survey structures like SurveyMonkey or others that we're using to collect survey responses, thinking about online meetings, stakeholder interviews, those types of things, right? And so, as we consider continuing to do collection remotely, becoming important is around the notion of digital literacy. And so I think that really must be a core consideration. And most of you who have done or are doing surveys already thought a lot about sort of digital literacy, right? There's always a support, need, right? What support materials can we provide? How straightforward is the survey, or is, a Zoom in order to do some of those stakeholder groups? Just making sure that you're providing those supports to folks, just because we know that, especially in the world that we work in, levels of technical sophistication vary widely between people. There are some folks that are very savvy, and then there are others that struggle a little bit more with adapting to new technologies. The other thing that we have to keep in mind here, as I note in this third bullet, is that data collection instruments should be mobile friendly. And thinking about the folks that we serve and the communities that we serve, what we've learned, especially from all of these school closings and just other remote working, is that not everyone is set up with a computer at home. Not everyone has reliable internet at home. And devices can really vary also in their technical sophistication, right? And so making sure everything is sort of what we would consider mobile friendly, but really it's about screen size, making sure that a survey that populates on your desktop looks just as good and works just as well on a mobile device or a tablet device is really important. This means testing these, and so hopefully folks within your office or, you know, trusted acquaintances, if you have an iPhone, maybe they have an Android, you can send it to them and just make sure that it looks okay, right? Again, also keeping those short and quantitative if possible. It's kind of hard sometimes, right, to write out a qualitative response to a survey if you are using a mobile device or a tablet that doesn't have sort of its own keyboard, right? So as many of those questions that you can shift to be a little bit more quantitative in nature, from a down or a list, you know, that would probably be or lend itself better than sort of a paragraph response. Consider reviewing privacy and recording policies to ensure they comply and reflect new technology. This is important if you are planning on doing any of your focus groups or stakeholder interviews, again, maybe via WebEx or Zoom or GoToMeeting or Google, whatever it may be, you know, there's always this recording option. And so we just want to make sure that folks are aware beforehand if you do plan to record those sessions. And typically we do that in our focus groups right at the very beginning. We show them our little recorder and ask everybody if it's okay. Just make sure that we weave that same behavior into these online virtual data collection methods as well. And then finally, just keeping in mind that participants will likely respond differently, no matter how many times you tell them to maybe think about conditions before COVID, you know, understand that folks' response are going to be shifted and will be affected, right, by what we're currently experiencing. And that's okay. So we'll talk a little bit about how we handle that. So continuing on to the next slide, we'll continue to talk a little bit about those collection methods and responses here. So a couple of things to keep in mind, right? Response rates may be lower. We're not able to do the same types or maybe the same amount of outreach that we were doing prior to COVID. You know, I know a lot of folks are able to talk about their surveys and focus groups face-to-face with their clients, right? The people that are coming in and out of your agency. And so not having that face-to-face interaction, you're not always able to get that same sort of engagement, right, or responses, not able to do the same sort of outreach. But I want you to know that that doesn't completely invalidate your data, right? A small number of responses, while maybe it is community, it is something that you can use as a snapshot or, you know, just an insight into maybe the older population of people. A couple of things to keep in mind. I did see a really great post recently where an organization was doing a survey and they included here, it says safe public Wi-Fi location. So it could be your city hall, parking lot of your, you know, those types of things. But also to encourage them to reply to your data collection or something like that might be helpful, especially for those folks that don't have unlimited data packages on their phones or something like, right? Having access to those, just being reminded of this sometimes can be very helpful. You know, your addiction, right? this may be a slightly skinnier community needs assessment than what you've produced in the past, based on what you're seeing out in the field, right? And so just making sure you note those types of things, I think, will be important. In addition, if you do have a group of people who have either they've replied and not necessarily as many responses as you thought you were going. You can basically weight those maybe as a smaller group or your smaller weighting. Let's see. I'm sorry that my audio is fading out. I think I'm just having lots of technical issues today. So, and then geographic distribution. So if you are only able to maybe reach people within a certain area, maybe just an immediate location, note that as well. That could be representative of a block group or a smaller group of people that you're interested in getting data from. Is my audio getting any better? I apologize.
It's kind of better here and there. So, I mean, I think at this point, yeah, just kind of continue, and we'll try to do our best on the back end.
Okay, great. So then the next bullet here, you see note significant reopen dates and milestones throughout your data collection process. Since we are all in different places in the country, these reopen dates are going to look different for everyone. And that's why I think it's really important for you all to be noting these dates and milestones throughout your data collection process, because dates in California obviously are going to look very different than reopen dates in New York or New Jersey, right? School closure dates looked different on the coast than they did towards the Midwest or the middle of the country. So noting those dates along with your data collection processes is going to be really important to understanding the shifts and when you get to your analysis, right? So some of those milestones obviously are pre-pandemic. So we're looking at probably prior to that, like around March 15th date. That quarantine period, if your state went into a lockdown, how long was that quarantine period? When did it start? When did it end? And then what I have here, post-COVID, that's really, up for you and your agency to decide. Is that when you returned back to the office? Is that when state-level restrictions were lifted? Is that when county-level restrictions were lifted, right? So just making sure you're noting those significant milestones. And then I also have here dates like when schools closed, when businesses were allowed to reopen. Other notable restrictions like those on milk and meat at grocery stores, recognizing that we know that food and food insecurity has sort of evolved as an emerging issue because of COVID. Those types of restrictions, like you can only buy 1 gallon of milk or you can only buy 2 packages of meat from, this date to this date, can be important and help us understanding those specific issues. So those are just some things to keep in mind as you are doing your data collection. So moving on to the next slide. We'll look at kind of thinking on for the in more of an analysis and prioritization phase. Here we're looking at, from post data collection or even during COVID, recognize that fear will cause shifts. And so a couple of examples of financial stability. Prior to COVID, you probably folks who were feeling a little bit more financially stable, right? We know the economy was pretty good in terms of jobs. Employment rates were able to, interest rates were low, those types of things, right? They felt much more secure than they probably do now, given that we know there are lots of folks who are unemployed or have been furloughed. Food security, as I mentioned earlier, prior to COVID, we probably saw a lot more people feeling more food secure because of their financial situation, and now we're seeing a shift towards more food insecurity, especially as we know that there are children that aren't receiving breakfast and lunch like they often do at school. Those issues may seem, a little bit more prominent as you're looking at your data during or post-COVID. Childcare arrangements and affordability, that's a conversation that seems to be happening more and more, especially as schools, again, are not opening for summer programs and those types of things. And so there probably will be some big shifts in response there, as well as safety. Just in general, people are feeling less safe. And so any questions that you have related to other types of safety may be affected by COVID just more generally because people aren't feeling as safe to be out in society. They're not feeling as safe to do their normal daily activities, right? So those are just some things to keep in mind. I have some other examples here that are where you may be able to see or you may end up seeing some shifts in response, right? Free and reduced lunch is an example of utilization data, right? Prior to COVID, we probably had a lot of, we had our normal amount of folks saying that they are eligible for or they are using free and reduced price lunch benefits. When school closed and we know that there's not going to be summer programs, if there is a question around are you using or are you eligible for these benefits, people may just say no, even though they are, just because they're not regularly using them, their children are not in school. So that would be something I would note, right? We talked a little bit about food security and food bank usage. We'll probably see that increase pretty significantly. If you have any questions around belonging and connectedness, that community connection, less connected, less of a sense of belonging. They may have more belonging to online communities, those types of things. Domestic violence, elsewhere we've seen shifts. There more reports, but there are less services available. The code, right? We're less likely to try to put someone in a different housing situation or, a temporary situation if we don't know, less exposure to those things. Crime, we've seen in general, since people are not leaving their homes nearly as much, there's not as much commerce happening back and forth, and so we've seen pretty significant decreases in some of the more violent crimes. But we may see increases, right, over time in things like property theft or just theft in general, right, as people feel that their financial situations are becoming more insecure. Same with housing stability. As rent becomes due and people are not able to make rent, those are some shifts that we'll potentially see. And then the last two here that I have are related around health insurance and Medicaid, right? We know that there are a lot of folks that are now on unemployment, likely have also lost any employer-sponsored health insurance, and therefore they may be reaching out for services related to Medicaid, Medicare, community health center services, those types of things, or questions around, COBRA or extended coverage. And so those are just some examples of where we may see quite a few shifts in response as we're looking at pre-COVID and then during or post-COVID data analysis and prioritization. So moving forward to the next slide, there's a couple of things that we can do, keeping some of those issues in mind as we're looking at our data and looking for patterns over time, right? And really, what I'm trying to hit home here is thinking about your data sort of within those timelines or those milestone chunks, right? pre-COVID data, looking at that as one grouping of data to prioritize and do analysis on. During COVID and then post-COVID being sort of the other two, right? And you're welcome to split those up into sort of more chunks if it makes sense based on, you know, how your state is reopening or reacting or putting in place restrictions, right? So what are the issues that started to gain traction as we, you know, started to enter this COVID period, right? Probably a lot of those that I had just mentioned. What are some that started here? Are there any that have sort of just gone away or that people really aren't talking about anymore? Or were there shifts in focus, right? And here I have, again, that March 15th date, probably because I'm here in Missouri. Other folks, I know that, you know, that may be a little bit late. You may want to look towards the beginning of March instead. And then I have what carries through here until mid-May, again, for other folks that may be later or earlier. Aggregate and group your data based on these notable milestones, as I said, and look for themes within and across the data. So as you're going through your data analysis process, if you take all of your sort of pre-COVID data, do a thematic review of that, then look at your during COVID data, do a thematic review for that, and then do the same thing for COVID. What are the themes that are within each of those, you know, notable milestone timeframes, and what are some that that are across all three of those, right? Those that emerge that are sort of pre, during, and post are probably going to be the data or the issues that you're going to want to prioritize the most, right? If there are themes that are within, so let's say during that middle during COVID time or during a quarantine time, you know, those may be issues that don't continue to be issues in a post-COVID, you know, environment. And so those may be less weighted or less important as you're doing your analysis. What are the themes emerging from sort of this post-COVID or, you know, recovery area, right? Are those going to be long-standing issues, or are they ones that seem to be short-lived? And just making notes of those. So while it does create a little bit more work for us on the analysis and the prioritization side of things, it will result in a more thorough and a better capture, really, of what those themes and issues are. And I think you'll feel a lot more confidence in reporting those issues if you're able to, again, aggregate and group these, look for themes within, and then across the data and across those milestones. Here, you know, I say note what issues shift the most. So not only what are those themes, but was there a dramatic shift from pre to during or during to post in some of those issues? Note what issues are persistent, right? Those are going to be the ones that you'll probably carry forward into your prioritization. And then here I just have a note at the bottom. Any pre-COVID client surveys you did should likely be weighted a little bit lower than the results from more or from broader community surveys. And what I mean by that and why I think that's important is that those client surveys were really pre-COVID, right? They were almost from another world at this time. Now, that doesn't mean that they should be discounted completely, but I think that they should be weighted a little bit lower. So as you're thinking about your prioritization, if there are pre-COVID client surveys and they were also talking about food insecurity, carry that through, obviously, to your prioritization or your action strategy process. But if they were talking about something that doesn't seem like it's going to be a long-term problem, then I would say that's something that needs just to be weighted a little bit moving forward. Those broader community surveys are going to give you a better idea probably of what issues folks are going to be challenged with and dealing with as we move into this recovery phase. And you know, people are talking about a year or 2 years worth of recovery. So those are the things given the CNA cycle that we're going to be wanting to focus on. So moving forward to the next slide, there's a couple of things that CARES has built in order to help you, community action agencies, and others identify the largest vulnerabilities in your community, or some of the most, the possible largest vulnerabilities in your community. So here we're looking at three major indicators. The first one being seniors age 65 and over. The second one being uninsured, meaning that they do not have health insurance or have recently lost their health insurance. And the last one being population density. So really thinking about some of those areas, probably more urban areas where we have lots of folks living in close quarters, a very close environment, right? So I would love just to hear from you all, you know, which of these vulnerabilities is most significant, do you feel like, in your region? Do you feel like you have more seniors? Do you feel like you have more uninsured folks? Or do you feel like population density is your biggest issue? So I'll pause here for a second. If you guys are able just to type one of those three into the chat box when you're ready.
I'm seeing several come in to me directly, and seeing a lot of responses about seniors, uninsured, population density.
Yeah, we had somebody say all three.
Seeing several seniors, many of those.
Yep. Okay. Yeah. And so what we know is obviously there are areas of the country where we have, you know, populations that are older, that are close to or above that age of 65, more vulnerable than some of the younger populations, right? Uninsured, we feel like, is an important indicator here, because if you don't have insurance, you're less likely to seek medical care. And especially during this time where there's a lot of uncertainty and a lot of misinformation about, are COVID tests free? Is care free? What if I need to be in the hospital or hospitalized? Can I afford that? Can I afford it for me and my family? You know, those types of issues. And then population density. Unfortunately, what we've seen in our more population dense areas like New York City is a reality that, you know, the more people you have in one place, the more likely the spread and the more vulnerability across the entire population, no matter age or insurance status. So Courtney, if you'll go to the next slide. Given my internet issues today, I'm not going to go into the live tool, but we do have this COVID-19 vulnerability footprint. And many of you may have been familiar with our previous, we have just a normal, I guess you would say, vulnerability footprint that looks at the intersection of poverty and education. So looking at areas with high poverty and low educational attainment. So we took that same methodology, that same model, and applied it here to these vulnerability indicators related to COVID. So what we're looking at within this footprint is a couple of different things. You'll see there's lots of colors, and each color has a meaning. We are looking at the intersections, though, again, of these indicators, which is important to note that we're not combining these data sets, right? And there may be some overlap between the folks that are in population dense areas and uninsured in population age 65 and over. And that's why we're not doing any combining. We're just looking at the intersections of these data. So areas in blue, we're looking at here, I've set my threshold to 1,320 people per square mile. So that's a population density threshold that you can set. You can move that upwards if you're in an urban area. You may look at 2,000 or 2,500 people per square mile in a more urban area. Or you may turn it all the way down to 100 if you're looking at a more rural area, right? Uninsured population is there in yellow, and we're looking at uninsured over a rate of 10%, meaning that 10% or greater of a population in those areas are considered uninsured. Finally, population age 65 and older. Here we're looking at a threshold of 15%. So we're looking at areas with a population that have age 65 and older greater than 15% of the total population. Then we get into those orange and sort of red areas, right? The orange that it meets 2 of the 3 thresholds, meaning population density and uninsured. It could be uninsured and population age 65 and older. It just needs to meet 2 of those thresholds. And then the red meets all 3. And so what's exciting but also sometimes confusing about a tool like this are those thresholds. And so we've had a couple of questions that have come in around those. So I will say the best way to set your thresholds is to look at what your state and national averages are. So for example, in a place, like New York, your population density, no matter what, you're going to want to turn it higher. But you could look at the population density average for the entire state of New York, or maybe for a grouping of counties around a city or a populous area, and get a better idea of what you should set that threshold at. Same with uninsured population, right? We know that maybe in more less dense areas, maybe more rural areas, that uninsured rate maybe is only going to be 7 or 8%. So you would maybe want to set it a little bit lower. But in a more urban area like St. Louis, you would maybe want to turn that up to maybe 15%. Same with population age 65 and older. I always use Florida as an example here, right? We know that there are many counties in Florida where you have very high populations of seniors living in retirement communities. So you may need to turn that population age 65 and older up much higher, or you could see you could turn the maximum down on that side. So there's some thresholds that you can change, and those are really to be able to accommodate your local conditions. Ultimately, though, what comes out of this is a nice report that shows you sort of those red areas where all 3 thresholds are met, and that's what we consider our footprint area. Those are areas where, again, as we're able to do more outreach education and provide additional support, either on the ground or virtually, we're going to want to do that because those are going to be our most vulnerable areas. They're areas where we have high density, high uninsured, and high populations age 65 and older. So those are just some examples there. So this tool is available on the Engagement Network, and then we do also have sort of a variety of other COVID-related tools that may or may not be of use to you. But this one really helps you drill down to say, as we're thinking about strategy when it comes to our CNA and what we're going to be working on the next 3 years, those areas of greatest vulnerability would be areas that you would probably want to highlight in some way in terms of how you're going to or how you plan to do outreach education and provide support. So I think do I have another slide here? I think that maybe we have questions. Yeah, a question slide. So with that, I'll pause and turn it back over and see if you have any questions or comments about what I've shown today or any of the bullets that we discussed.
All right, thank you, Jamie. We'll give everyone just a moment to type in any questions if you have them, and happy to have Jamie answer those now, and then we can also circle back to some at the end as well if more come up in the meantime. Had one question come in the Q&A asking if we can have if they can have access to the PowerPoint, which yes, we'll be sharing out this slide deck. We'll post it to our resource library on the partnership website. And so that's communityactionpartnership.com, and you go under Tools and Resources, and then the Resource Library, and we'll post both the recording as well as the PDF of these slides.
Great. One of the questions or comments that came in here, a couple of them said, we're hearing farm workers are afraid to get tested due to fear of bills and immigration issues. And then also we had someone mention African Americans and Hispanic populations. And so while we're not using those as one of those core indicators, race or ethnicity, the one thing I want to point out is in that vulnerability footprint tool, just like in our map room, there's a little add data button up there in the left-hand corner, and you can add race and ethnicity data to look at that and see how it intersects with some of those other vulnerability indicators. That is one thing that we've been trying very hard to find a reliable, consistent, and standardized data source for is around those cases and deaths by race and ethnicity, and we just don't have a validated source at the national level. Now, there are lots of states or local departments of health who are tracking the race and ethnicities of folks who are testing positive and those who have also are deceased. And so I would recommend, if that is a concern for your community, to definitely go to a local source. That's where you're going to find probably the most reliable race and ethnicity data. And we know that's so important in making sure that you are targeting the population.
Thank you, Jamie. That's helpful. All right. Well, at this time, I don't think I'm seeing any additional questions, but we'll be going on for just a few more minutes here as we wrap up and go into some different modifications for the community assessment with qualitative data collection. So feel free to continue to type in your questions, and we'll pause again at the end. So just wanted to talk a little bit about how to think a little bit differently about your community assessment during this time. Jamie offered a lot of great suggestions as well, but I wanted to focus a little bit more on internally and looking at your process of your community assessment and how that might look a little bit different right now if you're in that full process of assessing your community, as well as how you might engage the community a little bit differently as you're looking at qualitative data collection and things like focus groups, interviews, and things like that. So internally, your process might look a little bit different, and you might want to consider, building in a little bit extra time right now. And so if you're able to, of course, there's always deadlines and the requirements as far as when you have to have your community assessment into your state CSCG office or approved by your governing board. But just allowing yourself to take a look at that timeline and make sure you're considering, what makes sense right now and what you're able to adapt and what you have to stick to during this time. Also identifying staff capacities. I know staffing is looking a little bit different in quite a few of the organizations right now. So making sure you're thinking through what capacity your staff that are normally involved in this process have. And who you might consider to pull in that might be different, who might have some time to be able to spend on the community assessment, and maybe who doesn't have time anymore because they're doing something else right now. And so that's something to consider. Also, taking kind of an assessment of what virtual options and communication techniques that you have that you can use during this time. And because, incorporating virtual meetings, more online communication techniques is going to be really critical right now. Also notifying agency staff and community of the changes once those are established. So keeping those lines of communication open so people, understand what's going on, understand the changes in the process, and that sort of thing can be very helpful as you move forward. So people aren't maybe surprised by some changes if you've done it similarly over the past several years. Then whenever you look externally and how you're going to engage the community, this is going to look a little bit different too. We have a lot of states that are starting to reopen. Local areas are starting to get out and about more. People are starting to get together in places, but we're still encouraged to use a measure of social distancing, and some places are very much still kind of closed down. And so we need to make sure that we're being safe and being cautious during this time as well. And so making sure that we're thinking through that and not encouraging people to get together whenever it might not be good or necessary, depending on where you're at and what's going on. So one thing that we've seen some agencies do, and a lot of this stuff is still in progress. I've talked to some agencies in both Missouri and Alabama about how they're adjusting their community needs assessment processes. And some are using their surveys in different ways. So how to use those surveys more effectively and considering the questions that you're asking, whether it be on surveys or whether it be through your intake process, so that you're able to gather data for your community assessment in different ways, but trying to make it not cumbersome or additionally cumbersome on your customers or those that you want to get input from. So you might be considering new or different questions in light of COVID-19. And you also might be expanding online or distance accessible techniques. So making sure that people are able to access this information, take your surveys, even take intake through different methods so that they're able to still participate. We have some agencies that are doing kind of like a drive-through intake type method. And so we have some that are also adapting that to their community needs assessment process. So having people who are needing to do intake or who might be doing community needs assessment surveys and offering a drive-through option for them to complete those on iPads or offering private rooms to be able to go into to complete that information that keeps people distanced and safe. Also considering virtual meetings. And I'm going to talk a little bit more about how this can be done here in a moment, because this is something that can definitely be a challenge whenever you're thinking about how do you really conduct an effective focus group or community meeting to gather your data, with people not being in person. Virtual meetings can work well in many ways, but they can also be challenging. And so making sure that you're kind of being able to get that same quality of data. Also with key informant interviews, of course, going to like phone interviews or even video interviews instead of getting together in person. And polling techniques can be used as well to gather kind of quick snapshots of data. There's some online polling sites that can gather that type of data and compile that together without using a long survey type technique. So this was some information we came across from the Center for Healthcare Strategies, and there's some different groups that were in the midst of some, big community engagement projects, essentially. And so they have had to quickly adapt to keep their initiatives moving. And so there was some really great lessons that came out of this as far as how to engage the community in a virtual way, but still be able to have that engagement and then also get that good input from the participants. So these are some of their lessons that they shared out. And first was ensuring familiarity with online platforms. And so part of that is to make sure that you're connecting with people ahead of time and doing maybe a little bit of one-on-one coaching before you're engaging in those sessions to help reduce technical barriers to engagement. Also providing strong facilitation. So having a good facilitator to facilitate the engagement sessions or focus groups or whatever it might be is very important, because it's harder to read the room. It's also harder to make sure everyone is engaged in a virtual setting. And so there's different ways that a strong facilitator can make sure that all voices are heard and making sure that that process goes well. Also recognizing the desire for sharing. So this one was one that I found interesting because some of their feedback that they were receiving was that participants were really actually appreciating the opportunity to convene and discuss their experiences right now, because it ended up being also a stress reliever for them. So it's kind of one of those unintended benefits of this type of thing that you might think, well, gosh, people have so much going on, they're already so stressed out during this time. But at the same time, there might be, it might be healing and therapeutic to people to get together and share what they're experiencing during this time and what they're seeing in their community, what they're concerned about. So that was kind of I guess in a way, a bright spot of looking at this in a different way. Then also, still adding those personal gestures to make a difference. I know that whenever people hold focus groups and community meetings, sometimes they incentivize people with maybe a little bit of food or refreshments, maybe some coupons to get, a free ice cream or something like that afterwards. And so being able to still do those personal gestures can make a difference, and being able to still figure out ways to acknowledge and compensate community members for their time and sharing their expertise is still important in a very, in the virtual setting. And so I think there's different ways that you can do that online. If people are kind of registering for the session or signing up, you can send something to email if they have that. If not, something could be sent in the mail. So just being creative and thinking through how to still make those personal gestures, to kind of engage those and compensate and appreciate people. Also resonating with timely connections. And so this one was really about making sure that we're, quickly pivoting to discuss impact on the population, what this pandemic has really done. And so making sure that even in a lot of our efforts, different initiatives that we have in our agencies and things like that, that we're being very responsive to what those topics are that people want to discuss. And so making it meaningful to people, creating that space, and making sure that you're kind of trusting the customers or consumers with, kind of what those timely connections are and what they need during that time. And then lastly, recognizing the pros and cons of connecting virtually. So, just kind of having that discussion in your organization as you're thinking through different ways to do this. Hosting virtual gatherings can be often less costly than in-person meetings. Planning can be flexible in that way. So technology kind of allows for people who are geographically distant to participate in virtual convenings. So you might be able to kind of expand who you're looking at participating, across your service area, or do it in different ways because you're not as concerned about how people might travel to get there. So the cons, though, obviously, that you're probably thinking of as I say that is, whether people have internet connection or the ability to join remotely, or their hardware or software to be able to do that. And so that's where number one comes in, is making sure that people have not just familiarity, but even access to that type of being able to be involved. So, just thinking through what people have, how they can connect, and making accommodations so that everyone can truly participate. So this, really, whenever we're thinking about this, it's tedious, and it's, there's probably no great solution to some of this, but, it really does kind of create an opportunity for innovation and really developing strategies that, prioritize safety, make people feel comfortable when engaging, and making sure that all of these different aspects are really considered during this time. And it might lead to something that becomes more of a regular practice later down the road, because you realize that, something could be more effective and efficient using some online or virtual platforms. But I think that also, we'll never truly get away from the in-person contact, because that can be so important. So those are just some ideas we wanted to share. Very curious to know if there are anyone or if there is anyone out there that has already started to do something a little bit differently. Like I mentioned, there's a couple agencies we've spoken with that are in the midst of shifting things. They haven't quite kind of figured out exactly, what those modifications might be just yet, but they're exploring some different ways, trying some new things. So we might have some more lessons learned later on that. But if there's some things that you have done in your local agency that you found have worked or that you're going to try, we're definitely interested in hearing those. So feel free to type them in the chat, or if you'd like to contact us after the webinar. I think these are some of the things that we're interested in hearing about. So I'll give just a moment. I think I've seen some questions come in as well. Okay, we did have a question about suggestions for doing virtual community forums that include small group discussions. They're public agencies, so cannot use the chat function and have included this type of component in the past. So I think maybe that question was asked before I got to some of those other methods on the last slide. But those are kind of the suggestions we have at this point, as far as kind of how to make sure you're engaging people during that time. But I think that that can be a challenge to not be able to use the chat function, and because that could be one way to help engage people too. I'm going to also pause, and if Erin is still on the line, feel free to jump in on any of these questions as well. There's another question here, or comment, about how access and equity are the biggest barriers. So low-income board members who don't have computers and run out of data minutes before the end of the month. We're working with school districts to allow parents to use their children's Chromebooks to access services, as well as respond to needs assessment. So that's interesting to hear, working with school districts to use those kids' Chromebooks and access services, as well as respond to needs assessment. I think that's something that's, one of those opportunities to create those innovative strategies and create new partnerships to be able to access resources that others have that can be used for these purposes. So Erin, any other thoughts on that one, or what we've, the virtual community forums and such?
Yeah, a couple of thoughts on the issues of equity and this particular example of schools and Chromebooks. On the topic of equity, I just want to remind everyone that during this pandemic, we've seen once again, unfortunately, that there are existing inequities in our society that are being borne out in terms of how the virus is affecting different population groups. And unfortunately, we're seeing even public health agencies that are not always collecting the data that we need as a society to understand the differential impact, so that we can then respond accordingly to different communities. So I just want to reemphasize that community action really has a leadership opportunity here to make sure that, to the extent that we're able to collect data about the characteristics of the folks that we serve and the communities that we're working in, that could make a real difference to policymakers in terms of targeting resources effectively, so that communities that are disproportionately affected can be targeted to receive services in a more effective way. So I think equity is such an important part of our mission, and I think this is another opportunity for us as a network to emphasize that. And then on the example of the Chromebooks, I just want to put this in front of everybody. This is a great example of how community action can advocate for a whole family approach, and why the whole family approach is so critical. Because we've seen children who couldn't go to school, who depended on the free or reduced lunch program. We've seen how community action has responded to help ensure that they are able to eat, even if they can't go to school, and recognize that that's not something that affects only them; it affects their whole household and their whole family. This Chromebook example is another reminder of that, and so this is another opportunity for community action to explore new partnerships with school districts and other providers to help them better understand how the whole family is affected by these crises, and how we really do need to work together more to serve the whole family, not just the children, not just the employees, not just the seniors, but all of the people who touch their lives. And so there's opportunity in this crisis for community action to do some systems change work and make sure that our systems are more responsive to the communities that we serve.
All right, thank you, Erin. All good points for sure. So there were a couple other questions that came through the chat that I just want to quickly address. So we did have a question if there were any ways that agencies can get help with developing pre, during, and post-COVID-19 questions for their community needs assessment surveys. And I think this would definitely be something that I think would be helpful for agencies. And so we'll kind of put our heads together on this. And I know that there's some examples of agencies out there that are working on this currently. So it might be a matter of at least being able to pull together some different examples of what people are using as they ask these different types of questions. And so we'll try to see if we can get together at least some examples that could be shared out in relation to this topic. I think that could be very helpful as people are collecting different types of data during this time. Also, another question about verbiage being provided around these modifications. So I think that's talking about the same sort of thing, if I'm understanding that correctly. So, but feel free to clarify in the chat if I'm wrong on that. I think that's all that I'm seeing currently. If there are any other general questions, or comments about this topic that we've talked about today, or if there are additional modifications that you all have made, we'd love to hear from you. So we're always open to hearing from you, and I'll put up our contact information towards the end as well. But do just want to, as we close, mention the Webinar Wednesday topic for next week. And so a lot of our Webinar Wednesdays, as you can see, are related to the COVID-19 pandemic. I think during this time, the topic of trauma-informed care is also very important. So we're going to have a webinar on that next Wednesday, May 27th. You can register for that through the Webinars tab on our website under Upcoming Webinars. And then, of course, you can contact us. So the ones from the partnership team that you've seen here today, Erin, Lauren, and myself. Our contact information is here on the screen. And of course, we thank you to Jamie Kleinsorge as well, and coming to us from the University of Missouri Extension, and sharing her knowledge and tools and resources from the CARES engagement network and those different data tools. So do a quick check here to see if any more questions came in, but I think we covered most of them. Just a reminder that we will have slides and recording available through a follow-up email, as well as through the resource library on the partnership website. So you can refer back to these. And again, any other questions or anything, just feel free to reach out and contact us. And we hope that everyone has a wonderful day.